Good evening. The article that I chose for the Exam 3 Part 2 was titled Repeated Doses of Porcine Secretin and the Treatment of Autism, a randomized placebo-controlled trial by Roberts, Weaver, Bryan, Bryson, Emilianova, Griffiths, Buchanan, Yim, Wolpin, and Corinne by Stuart Mullen. All right. So a little bit of background about this study. It, as you can see on the slides, was basically Harvath stated that in a study that was conducted that included 3 children with autism, it showed that there was improvement in social and language skills after receiving secretin for gastrointestinal procedures. And that was done in 1998, and it was an uncontrolled case series, and the result of that gained media attention and increased popularity for the use of secretin as treatment for autism. Now, the reason this was an issue was a lot of people were, the treatment of secretin was gaining popularity, and a lot of people wanted to use that as a treatment for autism. So that was the significance of the past studies. So there's some background on that. Now, some more background. The recent placebo-controlled trials haven't showed any effects or benefits of secretin on language, cognitive, or behavioral measures. Possible reasons for this were that past designs only used single-dose injections, small sample sizes, and it used measures that aren't sensitive to the effects of drugs, and there was a lack of consideration for subgroups of the participants. All right. Which leads to the purpose of the present study. The purpose was to test the outcome of repeated doses and to examine if there is a subgroup of participants, children, who are more likely to have positive effects. All right. Now the methods. The participants used were 68 children aged 2 to 7 years old that were diagnosed with autism. Now, 64 were actually completed the study, and that included 9 females and 55 males. Now, the reason for only 64 completing the study was 1 participant left the study for personal reasons after the second injection of secretin, and 1 left due to hyperactivity after the first injection of the placebo, and 1 family lost contact after the second injection, and one was excluded after the final assessment due to the interruption of another medication. And all the participants were recruited through the Child Developmental Center of Hospital for Sick Children. All right, so the procedure itself. The participants were randomly assigned to the treatment group, which was the secretin, or the placebo groups via a random numbers table. So therefore, it was a randomized design, and that ensured that equal numbers of children at each age were included in both groups. It was also a pre-test, post-test control group design. Basically, there was an initial assessment prior to the administration of the drug or the placebo, so in baseline, and then there was a follow-up assessment 3 weeks after each injection. So there were 2 injections total in this study. And participants were given porcine secretin or placebo, which is saline, 2 times, which were 6 weeks apart. Now, the participants also, they confirmed their diagnosis of autism using the ADIR and the ADOSG, which the ADIR is a parent interview that provides information necessary for the diagnosis, and the ADOSG is used to confirm the diagnosis as well, and it is also used as an outcome measure during the follow-ups. And each participant, actually, whenever they were given the dose of the placebo or the secretin, was provided with a test dose of 0.1 milliliters of secretin or saline placebo, and then the vital signs were taken, and then if everything was okay, then they were given 2 milliliters of secretin or placebo. And then prior to them giving the treatment or the placebo, the parents and the participant were read off a script that stated what they were going to do and kind of what will happen once they do that, and like all the precautions. This just kind of helped them keep the participants blind to what was going on in the study. All right. Now the procedure. Basically, they measured a lot of things for the autistic symptomatology. Excuse me, sorry, that's a hard word. The ADOSG measured language, social, and behavioral features during the baseline and follow-up assessments. And for cognitive functioning, a Letter International Performance Scale revised was used, and that measured nonverbal intellectual ability at baseline and during the final follow-up. And for language, the preschool language scale, the third, was used to measure the expressive, receptive, and total language functioning at baseline and both follow-ups. And the visual spatial, for visual spatial attention, it just basically was used. It measured performance on simple visual orienting tasks at baseline and for both follow-up assessments. And then parent questionnaires were provided as well. And there were basically questions to the parents that covered gastrointestinal symptoms and treatment behavior side effects. It was a rating scale. And then one was used, it was also used for autism behavior checklist. It was an ABC checklist. And basically, for just to provide a little bit more background on that, the ADOSG was basically direct observation of the child and semi-structured play. And for the actual parent questionnaires, the gastrointestinal symptoms questionnaire, basically parents answer questions about their eating habits, GI symptoms, and frequency and severity of the existing problems. And the treatment behavior side effect rating scale was basically behavioral and physiological items that were rated on 4-point scale. And the autism behavior checklist, the ABC checklist, was a 57-item checklist of autistic behaviors with 5 subscales. So, all right, now the procedure continued. It also included the statistical analysis, which was basically a separate repeated measures ANOVAs, which assessed the group differences, and separate 2x4 ANOVAs conducted on ABC scores. And the group differences included the ADOSG, IQ, language scores, and number of failures to disengage attention. Sorry for that. All right, now the results. The subgroups created for the GI symptomatology, which was presence or absence, IQ, and history of regression. So those are the subgroups created for the study, and they didn't indicate a significant treatment difference between any of the subgroups on any measures. The ANOVAs also did not indicate any significant effects on measures ADOSG, ABC, or IQ. And the receptive, however, the receptive and expressive performance increased for both groups. With that said, the total language score did not change. And for the parent questionnaires, only 3 children reported to improve across several domains, but this wasn't sustained over time. Now to discuss this a little bit. So double doses, this indicated that double doses of secretin did not yield significant differences between groups on any measure. It was similar to the previous single-dose studies that were performed previously before this study, and the participants whose parents reported improvement didn't show any clinical improvement that was sustained over time. Therefore, there was no evidence to show the efficacy of secretin as a treatment for autism, which included, what this study indicated, for a double dose. It was a double dose study. All right, now getting to actually discuss the study and the pros and cons, and to determine if this was actually a good study and it was a strong study overall. Now let's begin with the cons. For the cons, there were some threats to internal and external. Some internal and external threats. One of those being, for the external threats is test sensitization. Oh my goodness gracious, sensitization. Excuse me. And basically, that's where the pretest impacts the responses of the post-test. Now, with this, it is a threat to external validity due to the fact that a pre-assessment was provided in baseline. This could actually have affected the responses that the participants gave and caused some threats to the results. And now, as for the internal threats to internal validity included maturation, testing, and history. Now, this was basically some proof of the threat to internal validity is that due to the results, receptive and expressive language improvement was seen in both groups, but that improvement didn't distinguish between the groups, which showed that for some reason both groups displayed improvements. And now, where did that come from? That could have come from maturation or testing or history. And due to that, is that because history meaning that there's ongoing behavioral interventions as this test is going on. So now, to get into more with that, for maturation, the threat to maturation is due to the length of the study. The study was conducted over weeks several weeks. So as it stated that this could be due to it could lead to a change in the subjects over time. So therefore, once they receive that first dose of placebo or secretin to that next dose, then they could have changed somehow on their own through maturation. Now through with testing, a threat to testing, this refers to repeated testing. As you can see, there were several tests that were provided and assessed in this study, and that may lead to bias. And repeated tests have found that this usually leads to score gains within the participants. And then for history, this just means that events outside of the study could have affected the results as well. So therefore, ongoing behavioral interventions could have played a role in other therapies that were received, that these participants received, could have played a role in the results that were obtained in this study. All right. And let's see here. Also, two other cons that could have come from this study are the that several tests were used to assess, used for assessment in this study. So the measure it measured several tests and variables. Now this could have complicated the process of finding significant differences between groups. So it's fantastic that they had so many studies and so many assessments going on, but this could have complicated and made it more difficult to discover significant differences. And also the use of a placebo on the control group, it may have presented ethical problems with the actual treatment not having any chance of working, with it just being saline. And now to the pros. For the pros. Basically, first and foremost, the pros is it was a pre-test, post-test control group design. And as we know, the strengths of that is it controls usual threats to internal validity. And it allows research, well, for the most part, and it allows researchers to match participants and increases statistical power, and it enables change. Now, the weaknesses is testing sensitization, which we discussed, and in some instances, non-equivalent groups, which could lead to attrition bias, selection maturation bias. But now this was countered by the randomization that was included in this test. So therefore, this was a very strong test that was used. And let's see here now, random selection. Now they were recruited from a organization, and so they were all recruited at random, which provided an equal probability that the subjects within the population could be selected. This enhanced the external validity of the study, and a very important aspect of it was the random assignment that was used, and it was used in a double-blind manner. So therefore, with that being said, they used a random numbers table. So therefore, the participants and also the researchers did not have any idea who would be placed in which group. And the variables were distributed in approximately the same manner in each group, and so therefore, with that being called randomization, it's the only method that can control for unknown variables, and it's very important to use, therefore. And then also they had a controlled administration of the independent variable, and they used reliable measurement with all those assessments. They had consistency of measurement in the pre-test and the post-test phases. And with all that said, that concludes my assessment of the article. So thank you and have a good night.